Hi, my name is Shaun Kunisaki, and I'm a general pediatric surgeon within the Division of General Pediatric Surgery here at the Johns Hopkins Children Center. In the specialty of pediatric surgery, I practice the full breadth, which includes often operating on children who need abdominal surgery, for example, to solve problems with the intestines, the stomach, as well as the appendix. I operate on children of all ages, and I've been doing that for over a decade now. Whenever possible, I try to use minimally invasive surgical approaches, which involve making small incisions, using sophisticated surgical instruments, which enable a faster recovery and minimal scarring. Within my specialty, I'm known both regionally as well as nationally for my work in pediatric chest surgery or thoracic surgery, where I take care of infants and children who have problems dealing with the esophagus, lungs, as well as the diaphragm. I'm very passionate about taking care of children with these rare disorders, and I'm fortunate that I've received the mentorship as well as surgical training to enable some of the best possible outcomes in these cases. My research is consistent with the mission of the Johns Hopkins Children Center, and that is to improve upon today's medical and surgical care of children so that future children can have even better outcomes. So when I'm not in the operating room or in the clinic, I'm often in the laboratory where I lead a team of scientists where we're working on novel approaches to both better understand as well as treat various major birth defects, which range from things like spina bifida, where there is a hole in the back of the spinal cord, which can lead to a lot of issues such as paralysis, to congenital diaphragmatic hernia, which is a disorder in which the lungs are abnormally small and don't function very well at birth. Well, I originally became a physician because I wanted to follow in the footsteps of my father, who was a young African-American physician who unfortunately died when I was only 6 weeks old. So he obviously left a legacy, although certainly I didn't know him. And I wanted to pursue kind of the unfinished business that he had kind of left behind in terms of helping others. When I graduated from Harvard Medical School, I knew I wanted to be a pediatric surgeon for a number of reasons. First, I absolutely love taking care of children. Children are amazing, exciting, fun to be around. And I really enjoy working with families from all walks of life and helping them through this healing journey. I also went into pediatric surgery because I thoroughly enjoy the privilege and honor of taking care of patients. I developed trust in parents that enables me to operate on their most prized possession in life, that is their son or daughter. It's not your house or your car or your job that's the most important thing. It's your children, and that's very powerful, and I'm honored to be a part of that process. My philosophy of patient care is based on the premise that I actually have 6 children of my own. So when I take care of a patient, I treat them as if I would want my own son or daughter to be treated. The child is a whole person and not just someone who has a surgical problem. And every family is unique and should be treated with the warmth and compassion that they deserve. I perform thousands and thousands of operations on children, but I always try to be aware of the fact that no matter how small the problem is that surgery can be terrifying for both the child as well as their families. And so my approach is to address these problems in a calm and thoughtful manner. I am an educator, and I try to leave ample time to answer any questions that they may have.